I've said it before and I'll say it again. If you're not willing to possibly lose some athleticism after limb lengthening, well then you probably shouldn't do it. What's up guys, Victor from Cyborg for Life, and today I want to talk about the possibility of losing some athleticism after limb lengthening surgery, even after you're fully recovered. Now, I've talked about this in past videos and live streams, but today we're going to focus on the major worry prospective patients have about recovering their athletic abilities and the reasons why people don't regain them. And then finally, we're going to discuss how you could get it all back and possibly even surpass your limits. Prospective patients say it all the time. I'm super worried about losing my athleticism after limb lengthening. Can I recover it all? I don't want to go through all this and then be any slower or weaker in my legs where I can't do what I'm doing now. And I'm like, okay, what exactly can you do now? And they're like, I don't know. I mean, I go to the gym and stuff. And I'm like, look, you will be fine. You'll be recovered enough to do everything you can do now with enough patience and effort. But for some, that isn't enough. And sometimes they do themselves a disservice by worrying so much that it limits their recovery potential. And what do I mean by this? Well, after speaking to hundreds of limb lengthening patients, I realized that there's both a physical and a mental aspect to regaining your athleticism post-op. The physical includes the flexibility of your soft tissues, the muscles to stabilize your joints, which allow for forceful power output, and finally the endurance to do this over and over again throughout your entire active range of motion without getting fatigued too early. Now, as a side note, I was going to discuss nerve conduction velocity because there's some minimal research on it saying that there might be some impact, but it's kind of conflicting, so it's hard to say. Now, when it comes to flexibility, I feel like patients get just flexible enough to where they can get back to walking normally and do basic everyday tasks that they enjoy doing, and that's it. I mean, that's fine. I'm super happy for them, but that's rarely ever it. You see, when you lengthen a limb, your muscle and fascia tissue are adaptive. They stretch and grow to accommodate to the hanger that they are attached to, aka your bones. But if you only walk and jog normally, do you really think that's enough to test your athletic recovery? What about running, sprinting, jumping, dynamic agility moves, and things that, you know, actually embody the term athleticism? Think about this. I had a patient who was about 18 months post-op, and he told me that he could walk and jog, you know, for about 3 miles normally. But then I challenged him and said, have you tried running full stride or even sprinting? And he said all this time that he's been cleared to do things all out, he never did. But then he said that he tried it, and he said it was much harder and he felt stiffness than when he only walks or jogs, where the active range of motion is much less. This highlights the fact that your muscles adapt to whatever range of motion that you work them through. The next physical aspect is muscle strength, and this is a huge factor after lengthening. I mean, in nearly every orthopedic surgery, the surgeons are aiming to do what? Correct the problem and stabilize the limb or joint, right? Well, what do you think that muscles do? That's right, they help to, you know, with joint stability, especially while you're in motion. So I'm kind of confused why patients, you know, who want to recover as fast as possible after limb lengthening slack on their resistance training. I mean, this is probably one of, if not the most effective way to get back to where you were before surgery for both strength and flexibility. Muscles also help you with your balance by allowing you to adapt much faster to your new center of gravity so you can, you know, do things more effectively like lifting, walking, running, sprinting, jumping, you know, all that good stuff. So how do you regain your muscle strength? Well, strength and size are two different things, but muscle is the consistent factor amongst the two. And you do need some muscle after limb lengthening because it looks like you have none after all the atrophy that took place over the 6 months sabbatical you were on. So you should definitely start by minding your nutrition and regimenting a resistance training program as you watch your body mass, you know, increase and your strength transform over time. Now, the final physical factor is endurance, specifically muscular endurance, because it's pretty easy to boost your cardiovascular endurance. You just got to do a cardio exercise longer. Now, when you lengthen your limbs, the muscles that are attached to those limbs that were lengthened might get a burning sensation to the point of a spasm or just overall fatigue. And this is because the muscular endurance is weak. And to boost this, you can do higher reps or take something like beta-alanine to help out with that. But time and time again, I hear of patients who want to do a 5 or 10K race, but they get back to their normal routine of work and a workout here and there. And then they complain that they can only regain, you know, 70% of their athletic ability. And worse yet, they go around telling other patients the same thing, that you can only regain this amount of, you know, your athletic ability, when they haven't even tested out their new legs or pushed their body's limits. So it's important to realize until you've boosted all the physical aspects of recovery, you really can't say that you've recovered only a certain percent. Now, on to the mental aspect that I feel holds people back from getting to their pre-limb lengthening heyday, which is self-imposed limitations. As I just pointed out, many times patients will just assume that they can't regain their abilities, either because they didn't try hard enough in the areas of flexibility, strength, or endurance, or they were told that they can only regain 70% of their abilities. And so once they felt like they got to that, they stopped. And this can lead to lackluster motivation and inconsistent effort, which will guarantee you won't get back to your abilities. And that is the truth. All right, so now we're gonna talk about the ways in which you can get your athleticism back after limb lengthening and possibly even surpass it. Now, although I do believe that you'll never be the same after surgery, there's still tons of hope for you to be as good, if not better than before. That being said, for pro athletes who are sponsored or paid to play, I don't recommend lengthening until you finish your sport to avoid taking a chance at jeopardizing your performance. That's not to say that you couldn't possibly do it, but would you rather flip a coin on whether or not you're gonna get to that high level again where milliseconds matter? I don't think so. After lengthening, your body's different. And this is because your limbs are different lengths and your biomechanics will be skewed, which is gonna affect your leverages and torque. Well, this means you need to train differently. If you lengthen your femurs anywhere from 5 to 8 centimeters, then you're gonna realize that when you're squatting with the same stance, it's gonna cause a forward lean and undue stress on your lower back due to the increased moment arm levers, aka longer femurs. But by taking a wider stance based on how much you lengthen, you can technically offset the skewed biomechanical shift, and you can once again sink into that deep squat, stimulating those quads, hams, glutes, adductors, and abductors, which will boost muscle strength and stability. I always tell patients that if you train smarter and harder than you did pre-surgery, you will have a very good chance that your body will adapt and get you to a higher level than you were previously. And this is true, but again, how often do you see, patients jog or run unless they're late for something? But I guess, what do you have to lose? All I'm gonna say is, look, limb lengthening is hard enough by itself, and regaining your athletic abilities in terms of physical strength and stamina to get back to or close to where you were before surgery, it's even harder. It's gonna take some time to adjust to your new biomechanics after you lengthen your femurs or your tibias, and lots of consistency to get into the gym when you don't want to, doing things like lifting weights, stretching, and cardio. But I'm gonna tell you right now, it's this grit, this psychological body armor, this cyborg mentality that will allow you to negate the negative thoughts and keep you or get you back on track. Not only have I had limb lengthening and a multitude of other injuries, a broken femur with an external fixator to hold it in place, multiple head lacerations that all needed stitches. I even tore my left pec tendon off the humerus bone last year and had to be put back together by medical intervention, and all of these injuries, every single one of them, hence the name cyborg. No, I'm just kidding. But the point is that you just survived limb lengthening. You're a beast. You're great. You're a freaking cyborg. Anybody who tries to say otherwise, screw them, keep it moving. What I'm trying to say is that if you get the surgery done safely, take it from me, the pain will fade, the memories of lengthening with the device are gonna fade, going to PT, hours of stretching, having limited mobility and having piss poor sleep, it's all gonna fade. Heck, even the scars are gonna fade a lot. But what doesn't go away is your lengthened limb and the pain that it relieves and or the height that you gain from it, okay? And every day you're gonna become grateful for the ability just to walk. But why stop there? Push yourself further. Go harder on your rehab and rebuilding process to the point where your resurgence will blast you past where you were before, and it'll be totally worth it. All right, guys, that's all I have for you today. Let me know down below, are you worried about losing athleticism after limb lengthening? And if so, why? And what do you plan to do about it? Hope you found the video helpful. If you did, go ahead and hit that like button. Be sure to subscribe. And until next time, this is Victor from Cyborg for Life, signing out.